All right, here we go. And we are live. Hello, hello. Good afternoon, everyone. Welcome to Metamorphosis from Trauma to Thriver podcast, where we talk about all things centered around anxiety, depression, PTSD, and dissociation. I'm your host, Sharon Ann. Today, I'm joined by our special guest, Adrienne. She's a mother of a very active and smart boy, a dental hygienist turned content writer. Wow, very talented. She struggled with mental health
Thank you.
issues. You're welcome. She struggled with mental health issues all her life and actually had seizures due to them. Adrienne, welcome to the show. Is there anything else you'd like to share with the audience about yourself?
Not really. That pretty much sums it up. Very smart
Awesome.
10-year-old boy, keeps me on my toes. That's for sure. And um, we're experiencing some behavioral issues and stuff with him too. So maybe it's just because we're smart. I don't know.
Wow. Does he have challenges too, if you don't mind me asking?
Yeah, he's been at the age of 3. He was diagnosed with what was it? A adjustment disorder with mixed emotion, with a disturbance of mixed emotions and something else. There's more to it, but I don't remember it all completely. Disturbance of mixed emotions and behavior or something. Like, yeah.
Oh, wow. So you have your own challenges on top of his that
Yeah,
you
he's
work
he's
with.
been in therapy since he was 3 and just learning to cope with everything and yeah.
Wow.
So get that on top of everything else. So fun.
I bet. I bet it's a challenge. Um, how do you adjust to the challenges of your own mental health with your child's?
um it's made me do a lot of reflecting actually to be able to sit down and talk to him and be like, mommy struggles with this too. It's not just something, that you're going through alone. And, it took me 30 something years to learn this. So I'm going to tell you now, you got to stay in control, and, it's hard and it's a struggle every single day, but it's something you got to learn. So, I mean, it just, instead of waiting 30 years to figure out where your thresholds and breaking points are, try and help them, give them a little insight ahead of time. Because, when I was growing up, there was a big stigma on the mental health and nobody talked about it. Nobody did anything about it. It's different now.
Right. I totally agree. We're taught from a young age, whatever your problems are, just to mask them, to not share them. And I'm like with you, sometimes it seems like other people don't understand trauma unless they've been through it. They don't
Right.
understand Caesars unless they've been through that. They don't understand mental health unless they've been down that path. And then I'm like, yeah, that so often we're like just batting an eye, or we turn to like worldly situations like, oh, it's all just in your mind. You're thinking
Mm-hmm.
about it. Like you don't know unless you know.
Yeah, my boyfriend for the longest time said, didn't believe my anxiety or didn't understand it. And then he actually experienced an anxiety attack or episode, and now he's apologized for it. It's like, those things you don't understand unless it happens to you or, gets more of an understanding. Yeah.
Right. What is your biggest struggle from day to day?
My biggest struggle, trying to keep my stress levels down and my anxiety down and not get so um, overwhelmed or overworked by the littlest things will cause me to fly off sometimes, and they're not big deals, but in my head they're huge. Everybody processes stress and things in different orders, and what's big to me isn't big to you, but
Right. There's all various forms of trauma. Totally true. Um, how do you cope with the seizures? And are you able to tell when one's about to happen?
um well, just until like a couple months ago, actually. uh, well, a couple years ago, my boyfriend at the time told me that I had a seizure, and I went to the doctor and we talked about it, and he told me it was from my anxiety, and I kind of laughed at him because I didn't believe it. It's like, how does that work? And then, I started doing my research, and I was like, okay, so this is a thing, because I didn't think it was a thing. I'd never heard about it before. But no, up until like a couple months ago, I actually had a seizure with convulsions, because they manifest in different ways. This is the first one, that second or third one I know of with convulsions. My boyfriend said, you looked at me, and I had this feeling come over me, and I've had the feeling before, but I never knew what it was. I couldn't explain it, so I never said anything to anybody about it. And then he said that I had the seizure. So now I know what feeling it is. I know what the quote unquote aura would be. But I don't really have enough time to react to try and prevent it, because that comes on, and within 30 seconds, apparently I'm in my episode. So because these come on in different ways, I think back on all the times that I felt this way. Sometimes they're just like staring episodes, or you're just like not with it for a little while. And I think about the times that I've had these feelings. I was making dinner once, and apparently I continued to make dinner and don't remember. I've been driving, and it's happened. And it's like, obviously I didn't have the convulsions in those situations, but it's still kind of scary to think about now that I know what this feeling associates with to what I was doing at other times.
That has to be a scary feeling to have one come on and not really know what to expect it. And I can only imagine what
Yeah,
it's like to be driving and to have an episode.
yeah, and they come out of nowhere. Like, I can't plan when it happens. Typically more when I'm more relaxed, because the body is releasing the stress. It tends to happen more those times when I'm relaxing, but like there's no rhyme or reason, or I can't find a specific trigger, or it just happens.
Do you have coping mechanisms that you use when you have a episode coming on or after episode that work for you?
Like I said, just knowing recently what the coping method. I mean, I've done the research. There are mechanisms, but I don't have enough time from the time that I have this feeling to the time that it actually happens. It's like I said, a matter of seconds. So I don't have really a lot of time to deal with the coping skills beforehand. And afterwards, it's like normal. Like, I'm like normal. I don't have any like drowsiness or weird effects. It's like I took a nap, is how I explain it to me. Like, I laid down for a few seconds and woke back up and just kept going.
Very well said.
And that's
Yeah.
the difference between these and the epileptic seizures, because they can present as epileptic seizures, but when you have an epileptic seizure, you tend to be drowsy afterwards, and this one doesn't come with a drowsiness. And so the last one was pretty bad, though. Like, I don't remember a lot. Apparently, like, I wanted to fight the paramedics because I didn't know where I was, or what was going on. Then I don't remember from that space till I was in the hospital. And it was weird because my boyfriend came in the room, and it was like one of those moments in the movies where like the person walks in and there's a bright light behind them, like they're the savior and stuff. And that's all I remember from that. But apparently I told them that I had these, they call them dissociative seizures now. They used to call them pseudo seizures. So that's the word I used. I was like, I have pseudo seizures. And they're basically like, oh, all right, here you go, discharge, because there's nothing they can do.
That's a good word to use because I know there's like dissociative identities, dissociative fugue, dissociative amnesia, and a few other ones too.
Mm-hmm.
And
yeah,
earlier,
they used to use pseudo seizures because it wasn't neurologic, but because pseudo means fake, it started implying that people weren't really having the seizures and stuff. So they changed the wording.
right. What help do you have medical wise before and after an episode?
Well, there's really not much that they can do medically other than therapy. Like cognitive behavioral control therapy, or mindfulness therapy, or psychodynamic therapy. It's all therapeutic. Medications aren't going to help. You might be able to take the medications for the depression or the anxiety, which will make you feel better there, which may reduce the seizures, but may not at the same time. So it's not like I can take medicine like an epileptic can to control them.
Right, because
medicine all in my head.
I don't say that. I completely disagree because sometimes you can feel so normal to the world on the outside, Yet in reality, you're going through so much on the inside. It's
Oh,
perception, how other people see things.
I hide it. I hide it very well. Most people would never think that I struggle with what I struggle with.
And that's the way it is with a lot of mental health problems. We are so great at hiding them. We're so great at putting on that mask. We're so great at appearing normal. When inside it's like we want to scream or pull our hair
Right.
or something. Yeah.
Or just lay down and not get up.
Right. Which would be the norm.
Right.
Let's see. I have a whole list of questions that I had in mind for you. How do you balance relationships in the midst of your mental health?
How do I what?
How do you balance relationships in the midst of your mental health?
Um, I just try and talk and be as open as I can with the people around me with what's going on. Now that I've, been dealing with this for 30 something years, I can notice certain signs and certain things. And I'll tell them, I know this is an excuse, but this is going on right now. So if I act like this or do this, it's not necessarily because of you. It's just what's going on with me. And I don't mean to do these things. And so I just, honest communication is the best thing that I find with my family, even though some of them don't understand it, but I still tell them anyway.
That's awesome. Yeah. You try to take the good with the bad. Try to take the
Right.
challenging. Yeah. Can you describe your experience with anxiety and what activities are affected the most?
Um, yeah, anxiety happens a lot. Most people can't tell again, but I have little things I do, like I rub my fingers together like this on my side, and there's been times that I've been with friends and I just got the anxiety so bad that I started crying and I had to leave, and I blamed it on a back problem. I was like, my back is bothering me, I have to go, and just left. So um, I never know when it's going to get bad. And I never know. It's the hardest thing, is not knowing how things are going to go. Like, I don't know.
No, it makes complete sense. I'm the same way, very relatable. I struggle with anxiety too. Sometimes I go into a situation as well and I'll have a complete meltdown. It's like I have to prepare myself before I go into the situation. I have to
And
talk to
sometimes that makes you more
her.
anxious.
Yeah. So that's how
Yep.
how I cope. I do a lot of self-talk too.
Hmm.
Um, what challenges do you face when you're around mental health providers and they're like, you're making it up? Are they like, I believe you, but I don't believe you?
I haven't really run into that problem. Um, but the seizures, like, I've been out of therapy for a little while. I'm really trying to get back into it. So since I've figured all this out, I really haven't seen a therapist to talk about it. But like, my doctor is very supportive. I haven't run into any situation that I've been faced with. You're not. It's not what you're saying. So I mean, I haven't. Fortunately, I haven't had to deal with that.
You can't beat that because sometimes doctors are like, I believe you, I don't believe you, or they're like, that can't be right, or they're so quick to label you one thing when in reality it's something else. So that's a good
Right.
note.
Well, I've been seeing the same doctor for almost 20 years now, so he knows me too. I mean, I can get an upper respiratory infection and call him, and he'll call in the meds without even seeing me, and then I'll go in later. But when I said to him I had a seizure, that's the first thing he said. He was like, "It's caused by anxiety." There was no other question about it. He was just right off the rip. But he knows my past too, my history. So
That's a good doctor because doctors sometimes come and go, and it's hard to find a really good doctor
yeah,
who
and
really
and
gets
the
you.
dissociative seizures are very often misdiagnosed, because they're diagnosed as epileptic seizures, or there's other conditions that mimic the same symptoms. So there's other things that they have to rule out too before saying that's what it is. Like 25 to 20% of people receive an epileptic diagnosis when they're not. So
That's a pretty high number. I mean, like when you think about it, it doesn't seem so high, but when you analyze the numbers, you're like, oh my gosh, it's high.
Right. It's more than a third of people who've been diagnosed with seizures that don't actually have epileptic seizures.
Wow. In your journey, how has self-awareness played a role in addressing dissociative seizures or depression or anxiety?
It took me a long time, first of all, to come to accept all of the diagnoses and stop and think about and actually like deal with them. I'm a runner. I will run and go and go and go and not deal with something. If so, I've learned to slow down and actually think about what's going on and deal with it, and you know and like I said, this is all new, that I'm going through all these new changes in my life, mostly because of my son, because I have to be able to teach him, so I have to teach myself at the same time. So I'm just starting to reflect and learn and deal.
That's awesome. I can tell through the way you're talking and your smile and your enthusiasm that your son's your life. You want what's best for him.
Yeah,
You don't want him to follow in the same path of like seizures and stuff. You can tell that right away.
right.
Yes.
Not even that. There's other choices in life that I've made in the past that I don't want to see him make because of my mental health issues that weren't one diagnosed or addressed for a very long time. So, I gotta be proactive with him.
Right. How have you encountered the stigmas surrounding your condition? Like, have you been able to cope with them or have they like run into other areas of your life? The stigma.
um, I've always been outspoken about it, especially against those with the stigma, because I don't know, it's not something that should be brushed under a rug, because everybody in some way or some shape or form has some sort of mental issue. I mean, it's a common thing, and it's not like the person needs to be locked up somewhere and kept away from society. Like, I'm very proactive about it. I don't care what people think. I will tell them what's going on with me, what my situation is, and I don't care what you think. You think what you want, but that's what it is.
That's awesome. I love your philosophy right there. Think what you want to think. It shows that you're taking back your voice, you're taking back your power, and that's awesome.
Well, it took so long to figure out what it was, and some of it still isn't even 100%. Like, I have an undiagnosed mood disorder. Like, they haven't. There's a mood problem, and I don't know what we don't know. I don't know that they don't know what it is, or if I just span too many different disorders or personality issues that they can't put like one on it. So it's like, why is it unspecified? Why can't you give me an answer here? That's more nerve wracking than.
I hear you too. Yeah. Because I remember when I was diagnosed DID, dissociative identity, before that, it was like, oh, you're autistic. Oh, you're bipolar. Or, oh, you have this. And it took
Mhm.
7 years for them to get an accurate diagnosis. So totally relatable. And I don't
Yeah,
understand where the NOS comes in either.
yeah. I don't know. It's like, why can't you just? I don't know. I think they'd be able to do something, but I'm thinking that it's because they've said lower lower level of bipolar, they've said personality disorder, they've said borderline, they've said this, and it's just like they don't give me like, but they can treat it, right? They can't give me an answer, but they can treat it.
Exactly. Exactly. If anybody knows the difference between NOS and DID, NOS, or whatever, please let us know. That'd be awesome.
Right?
Yes. And that leads me into my next question. How has the label affected your life, or does the label affect your life with your diagnosis?
I try not to let it affect my life, but then because of certain things, I think more with the personality disorder, there's the spontaneity and impulsivity where you do things when you don't act. And then when I try and explain myself, I don't have answers for people, and they can't accept the fact that I don't have an answer for you. I don't know why. It just So, I mean, that's the biggest setback, I think, is trying to explain what I did, but I can't because I don't even know why.
But you're doing the best you can, and in reality, that's all that matters. What techniques help you the most therapy wise? I mean, like I know you said you're not in therapy anymore, so maybe we should phrase that. What techniques besides cognitive behavior therapy have helped you in the past?
Really, that's about it. I mean, was the therapies that been the best help. I was taking lithium for a little while, but then found out I was pregnant, so I had to stop that. So we didn't really have enough time to see if that was going to help. But I'd rather go unmedicated if possible, which I've done for 41 years now. Like the psychotherapy, the talking, and but finding somebody that I trust enough to talk to becomes the issue too. But that's been the biggest help is the therapy.
That's awesome. And I'm glad you're able to get the help because some people have mental health conditions and they're limited in their help. That their only help is like a support group. And sometimes even that doesn't seem like it's enough.
Right. Yeah. Well, and my insurance, I ran out of my insurance and I was trying to pay out of pocket, but I couldn't afford it. It's so expensive. Um, and that's where kind of drizzled off. And then, this was shortly after my son was born. So I had him and it's been one of those things that I've put on the back burner. And now I got to try and find someone who, first of all, accepts the state insurance that I have and then be able to go from there. Because that's difficult.
It is difficult. I hear you, and I can relate to you exactly. State insurance isn't the best insurance. No offense to anybody or anything, because I'm in the same boat. One of the things that I've had to learn was to go to a school, to go to an intern, to go to a graduate person. I mean, they have the training, they're just starting out. So it's low income, it's like pro bono help.
Mm-hmm. Right. I didn't even think about that going that route.
Yep, I recommend it if you can. I mean, it's not the best, but it's better than
It's better
nothing.
than nothing.
Right. How has connecting to support groups or the community impacted your healing process?
Just knowing you're not alone. There's other people out there that are struggling just as much, if not maybe a little more, or other symptoms. They have other things going on. So, I mean, knowing I'm not alone and there's a community out there that can help is helpful.
That is very true. There's power in the support groups. Are there any strategies, intervention strategies that you have or you would recommend to other people?
Um, if you just go and see somebody, like if you suspect something, talk to your doctor, go and see a therapist. Like, who cares what anybody thinks? I mean, you got to take care of you. And if you think there's a problem, address it. Like that's the best I can, before it gets to a point where you're really in a situation.
That is true because sometimes we wait till the last minute to ask for help. Sometimes we wait till things are really bad before we get the help we need.
Yeah. Or you don't even like, I have a real hard time asking for help as it is. So, I mean, sometimes it takes somebody else noticing what's going on. And I mean, I've had people call do well-being checks on me, or called and I don't think she's doing well, and I ended up in the behavioral units because I didn't care, so I was just doing whatever, and
Right.
whatever happened. It wasn't anything that, yeah, I didn't care. If I end up hurt, if I end up dead, if I end up wherever, it didn't matter to me. But I was lucky enough to have people around me who cared and actually made the calls. As much as you want to be mad at them at the moment, it probably saved my life.
Exactly. Yep. Sometimes the things that we don't like are the things that we find are harmful, are the things that exactly we need.
And to be grateful to have people around me that care enough to notice and do something.
Right. That's awesome. And it shows their integrity. It shows that you're well loved. Let's see. Last question I have is, if you can give one piece of advice or one piece of feedback to someone struggling with a mental health issue, what would it be?
You're not alone. Find someone you can relate to talk to help you, to give you advice, to lead you in the right direction. Don't let it take you over.
Awesome words. Is there anything else that you would like to say to the audience?
No, be happy, be well, take care of you.
Awesome.
Forget the
Powerful words.
stigmas.
Yeah, awesome, powerful words. Thank you, Adrienne, for your time here. I really appreciate it. To the audience, if you would like Adrienne to come back, please let us know. If you have a topic you would like one of us to discuss, please let us know in the comments. Adrienne, thank you for your time. It's been a pleasure meeting you.
Thank you for
A
having
pleasure
me.
having this time with you. You're welcome. Thank you, everyone. Bye.
Thank you.